Hello, I'm Dr. Fackrell. Welcome to Health Corner. Tonight I'm talking about hypothyroidism. One of the reasons people come to see me is because they're tired, because they've gained weight and they can't lose it, and because they don't feel well, and anxiety, they have sometimes anxiety or depression. All of these things could be related to the thyroid. One of the common things we do is we check a thyroid with a TSH and see. If we do find hypothyroidism, there are things that we can do that can significantly help them. A lot of times if the thyroid's off and we fix it, they start feeling better, there can be weight, it can be improved, and other benefits. I'm going to turn the time to Jessie, the PA student who has worked with me in the past, and she's going to discuss this in more detail.
Hello, my name is Jessie. I'm a PA student, as Dr. Fackrell said, and today we'll be talking about hypothyroidism. Before we get started, I'd like to explain the thyroid gland and how it works in the body. Thyroid hormone is controlled by the hypothalamus pituitary thyroid axis, and I'd like to explain that now. First, let's start out with the brain. This is a picture of the brain, and you can see the black box is showing the part of the brain that houses the hypothalamus and the pituitary gland. This picture is a picture of the hypothalamus, pituitary gland, and the thyroid. As you can see, the thyroid, where the thyroid gland actually sits in the body in the picture to your far right. There are many steps when you're thinking about how thyroid hormone is released into the body, but let's start at the hypothalamus. The hypothalamus is responsible for controlling a lot of the hormones within our body. But let's just stick to the thyroid hormone again. And let's say that the body has low thyroid hormone. Hypothalamus's job is to sense this. And when it senses this, it releases its own hormone called thyrotropin releasing hormone, or TRH, which is highlighted in the yellow box. TRH goes and tells the pituitary gland that it needs to secrete its own hormone known as thyroid stimulating hormone. Thyroid stimulating hormone, or TSH, then goes directly to, as you can see if you follow the blue arrow, to the thyroid gland itself, and like the name suggests, it stimulates the thyroid to start releasing actual thyroid hormone throughout our body. Thyroid hormone is also known as T3 and T4. Those are abbreviated names, and I won't give you the big flowery name, but just know that that's an abbreviation of actual thyroid hormone in your body. It may be helpful for you to know that because some of the lab tests actually are known as free T4 or T3, and I'll talk about those a little bit later. As you may be wondering, there are many steps to this process. So along the way, a tumor could grow in the pituitary gland, or the thyroid itself may not be functioning correctly, or many other things can happen that will cause a decrease in thyroid hormone. And again, we'll talk about this a little bit later, but I think it's just important to realize that there are many steps to secreting thyroid hormone, and that a problem could be in any part of the pathway that I just suggested. Now, it's also good to know that thyroid hormone, or T3 and T4, also tell the hypothalamus when to stop producing thyroid hormone. And they do this when there's a set level in your body that your body needs, and if the level is above that or below that, the hypothalamus acts accordingly. When there is an abnormal secretion of thyroid hormones, either too low or too high, obviously this affects our body. So first, let's start with too much thyroid hormone, which is also known as hyperthyroidism. This again is just increased secretion of T3 and T4. Remember, thyroid hormone acts on your metabolism, so too much of it will increase your metabolic rate, which may cause weight loss. Also, in spite of losing weight, your appetite will increase. Another symptom that will be present is it will cause anxiety. You may feel restless, and you may be just mentally really excited. You have a hard time calming down. Hair loss is also seen with people who have too much thyroid hormone, as well as an increased heart rate, and even it can throw off the rhythm of your heart because that heart rate gets increased. You may have warm, sweaty skin, and you may be intolerant to heat. Also, it acts on your intestines, causing diarrhea, which I'm sure contributes to the weight loss. One last thing that's specific for or special to hyperthyroidism is called exophthalmos, which is just when the actual eyes are affected by the thyroid hormone. It can actually cause the eyes to bulge, and I think I talk about this in a little bit, so I'll save that for later, but it does need to be treated because it can lead to blindness. Next, hypothyroidism is decreased thyroid hormone, and this again is what we're talking about today, and quickly I'll go over these symptoms. So as you are thinking, if you don't have enough thyroid hormone, your metabolism will be slower, which will cause depressive symptoms, maybe even psychosis, mental slowness, as well as lethargy or weakness. You're tired, you're just not feeling as motivated as normal. Your skin may be dry, your hair is brittle, you may have a slower heart rate, your skin is dry and cold, and you actually have a cold intolerance, so you always feel cold and you don't feel like you ever get warm. It also will affect your intestines, just like hyperthyroidism, but because you have not enough thyroid hormone, you will have constipation instead of diarrhea. And then obviously weight gain in spite of not having much of an appetite. So as you can see, it's good to compare these and just kind of know the process. It helps you understand maybe how your body will feel or what signs or symptoms may happen when you have hypothyroidism. Thyroid hormone is especially important with growth and development of the brain. So, if you're pregnant, this is one of the things that they test on your prenatal visits, and while you're pregnant, they'll test you every so often for your thyroid hormone. Again, it's very important for the development of the brain in babies and in fetuses. We've mentioned signs and symptoms, but what actually causes the thyroid gland to not produce enough thyroid hormone in the body? There are many, many causes, and as we talked about the physiology and the axis, the hypopituitary thyroid axis that is in the body that helps control the thyroid hormone, you may be thinking, well, you could have lots of different problems along each of those pathways, and you're right. But the statistics show that 99% of cases have problems with the thyroid gland itself. So that helps us as practitioners determine what is causing the disease. I would like to include right now a few other symptoms that are specific for hypothyroidism. These include that hair growth is slowed or retarded. This means that you may notice that you don't have to shave quite as often. This could be a sign of hypothyroidism. Your nails grow slower and they become brittle. So you may notice that you don't have to clip them or trim them as often. And they might break off really easy, maybe a lot more easily than when you were younger. When your doctor or your PA tests your reflexes, they may be delayed. This is more common in severe hypothyroidism. Anemia may be present. This means that you bruise easily, you have pale, light skin, and also you lack energy. This is often present with hypothyroidism too. Again, thyroid hormone has to do with metabolism. This means that if there's not enough, then your metabolism is slowed, and it can affect the blood cholesterol that you have. This can cause hyperlipidemia, which means that you have too high a blood cholesterol, which when we talked about heart attacks, this can predispose you to a heart attack and can cause problems. You may have a hard time breathing when you're exercising. Your joints and your muscles may ache or cramp. You may have headaches. You may also have numbness or tingling in your limbs. All of these are not very common symptoms but can be present with hypothyroidism. Another thing you may notice with your dry skin is that your wounds, if you get cut, it doesn't heal like it normally does. It heals slowly. I've decided to include a few of the most common causes of hypothyroidism. Thought it might be helpful. One specific cause of hypothyroidism is Hashimoto's hypothyroidism. This is an autoimmune disease that attacks the thyroid gland, where the thyroid gland tissue dies and actually your body kills it, which means you don't have enough thyroid hormone to go out to your organs of your body. You may have an iodine deficiency. Salt is now iodized. You may see that on labels of salt. This means that they've added iodine to salt to decrease the chance of the people in our country having hypothyroidism. So, goiters may develop with an iodine deficiency, and you may have heard that. This is a lot more common now in the developing or third world countries, and that's because they lack iodine. Here in the US, it's really uncommon because of our iodized salt and other products with iodine in it. Certain drugs may block the actual synthesis of thyroid hormones in your body. This just means that there may be certain medications that you're taking, such as lithium is one, or ethionamide or any sulfonamide may decrease this transaction or this conversion of T3 to T4 specifically, which will cause hypothyroidism or lack of the thyroid hormone that you need in your body. So, are there people that are more likely to have hypothyroidism? Yes, there are. Those who are taking amiodarone, those with hepatitis C, and those over 60 have an increased chance of having hypothyroidism. That's why people that are over 60, we commonly check this on routine physical exams. We check the TSH level to determine if their thyroid hormone is okay. When you come into the doctor and we suspect hypothyroidism, we can order blood tests to determine what your thyroid level is at. These are the common lab tests that are ordered. First, TSH level. Again, you know what this is. So we level it, or we check the level of it, and then we determine whether or not hypothyroidism is present. Another test we can do is free T4 or T3. Both of those will tell us how the thyroid is functioning. Another thing we'll check is fasting lipid profile. As I mentioned before, if you have hypothyroidism, there's a chance your lipids are going to be off and you're going to have high cholesterol. So we need to make sure that we check this, especially after someone's been diagnosed with hypothyroidism. Another thing to check is blood glucose level, because again, the metabolism is affected. If there's not enough thyroid hormone, then there's a chance you could have increased blood glucose and maybe develop an insulin resistance or even type 2 diabetes. Remember, one of the symptoms was anemia. With this, we check a CBC. This will tell us whether or not a patient is anemic. We can also check the electrolytes within your body to see if there are any abnormalities. Although this is not specific in diagnosing hypothyroidism, it will help us get a picture of what's going on within the body. Lastly, what do you do if you have hypothyroidism? Well, regardless of the cause of hypothyroidism, the treatment's the same. The first line drug is levothyroxine. It is a synthetic thyroid hormone. Initially, when you start on this medication, thyroid functioning tests are taken. In other words, we look at your thyroid hormones in your body. And we increase the dose of the medication based on the thyroid hormone levels in your blood. This helps us get to the point where we need to be. So we start you on the lowest dose, and then we slowly increase it. So every 4 to 6 weeks, initially you'll come back to the doctor and get repeated blood tests to make sure that your thyroid hormone levels in your blood are appropriate and where they need to be. If you feel like you have any of these symptoms, or have any questions at all regarding hypothyroidism or hyperthyroidism, please come in and see your doctor or your PA and we'll be glad to help.